Hello, good evening. How are you? Welcome. It's another Sunday again. Today is the 22nd of January 2023, and the time is 8 p.m. This is Ask the Doctors, a health program that goes on every Sunday by 8 p.m. West African time. My name is Frederick Mubohai, and I always tell you good life na sense. Now, if you're watching this video after we have ended, I'm sorry I would not respond to you, not because I don't want to respond to you, but because we are no more live. So please look up and see if we are live. But if we are no more live, I'm sorry, I might not respond to you. But right now, I am live. The time is 8 p.m. and I have 11 people watching this program. We are live on Facebook and we are live on YouTube. So wherever you are, just tell me hello, good evening, and tell me where you're joining me from. Good. If you can hear me, hi, good evening. How are you? So tell me, where are you joining me from? I know you can hear me, Abby. Here you can hear me. But yeah, talk to me. Good evening, everybody. Who do we have in the house? Oh yeah, let's go. Talk to me quickly. Stop looking now. Let's interact. Yes, Jessica. Jessica Chukwuemeka, good evening. Blessing. I can't see what you sent. Sorry. Ella, hi. Good evening. Onome. Where are you joining me from? Michael. Say, bro. How far now? How you day? So we are live on Facebook and we are live on uh, YouTube. Those on YouTube, hope you can hear me. Good evening. Good evening. Onome, I'm doing very well. Where are you joining me from? From Abuja. Okay. Michael from Germany. I see you. Yes. Florence. Florence, how far now? Good evening. Bless you. Bless you too. Yeah. Tell me where. Ivie. Boss, I greet you. How you doing now? Ella from UK. Okay. Miriam from Lokoja. Ladies and gentlemen, let's share this live video. Thank you. Make una help me share. Share everybody. Everybody from Kano. Good evening, Jessica. Osifo Osaro from Italy. Ibam, how was your day? Man, my day has been okay. We thank God though. With the hustle and with the push and small small. Esther, good evening. I'm Siko. Waiting they seek you. Jessica from Oka. Onome is joining us from Delta State. Okay. So everybody, welcome. Now today's program is a question and answer session. We are not teaching, we're taking questions. Now remember, this program is just to educate. Please read what is going through the screen. There are some very important informations there. I beg you. We don't prescribe here, number one. Number two, we don't give out our personal contacts here. So in case you're on this platform and you're looking for medication, I'm sorry, I'm not going to prescribe any medicine for you. This place is just to educate you. We always tell you to speak with your doctor. Is that okay? Okay, please share the live stream, ladies and gentlemen. Share the live, share the live. Good evening, please. What medication can one use for power caused by pregnancy? You should be speaking with your doctor, madam. This is not a clinic. Willow from Liberia, I see you. Told you from Worry. Good evening. How do you do? I'm doing well. I'm joining in from Ilorin. What causes leg ulcer that has refused to heal? You can't say what causes leg ulcer that has refused to heal. There are many things that can cause leg ulcer. Many things. Many. Hmm? It could be from the blood vessel around that region. It could be metabolic condition. It could be malignancy. So there are many things that can make a leg ulcer not heal. You understand? A doctor would help you arrive at a diagnosis. Chronic is called chronic leg ulcer, even in sickle cell too. Good evening, blessing. See as you fresh like tomorrow bread. Oh my God. They want me, Abby. Good evening, Chisom. My throat hurts and I'm feeling headache. What's the cause? I can't say why your throat hurts and you feel headache. Ladies and gentlemen, people are not sharing this live stream. Oh yeah, everybody make una share. When you share, tell me I have shared. Oh yeah. Hmm? Share, everybody share. And then don't forget to send stars. Yes, you can send stars. Very important. Encourage this live stream by sending stars. I subscribe, I pay to be able to have this live stream like this. You understand? So I can't tell you why you are having sore throat and you're having headache. It could be from the weather, it could be viral, it could be bacterial. I can't really say what it is. You understand? Yeah. Um, Basically, sore throat could be viral, most commonly viral. So we'll tell you take an analgesic, take warm water. But if it's an infective condition like bacteria, you might need antibiotics. Yeah. Rebecca from Oyo, Gawain from Abuja. Rebecca, good evening. Baba, have fun now. How you day? How you day? How family? You know, go work today, Abi. Please, doctor, what are the causes of nose bleeding, especially during dry season and cold? Yeah, during dry season, people can have nose bleeding occasionally. Just notice that the nose bleeds because when the weather is cold or very dry, the blood vessels around your nose, the nasal plexuses, they are very tiny inside. Any little thing can make it tear. When it tear, blood comes out. So what you do is you can apply pressure over your nostril like this. You breathe with your mouth. It could stop. But if you have done that, you've done that, and the bleeding still continues, you would need to see a doctor. Ladies and gentlemen, people are not sharing this live stream. People are not sharing. People are not sharing. You people are not sharing at all. Let me see, say people are not sharing. I have thrush on my tongue and did not go away. How do you know it is called thrush, madam? Oladuni, how do you know it's thrush? Who told you what you have is thrush? People are not sharing this live stream. Good evening. Please explain systemic everything. And also the post complication of myomectomy is aperistalsis. So who is this? Olayinka Samuel Tosin. Where did you come across SLE? You didn't even get it. It's systemic lupus erythematosus. Number one. Number two, myomectomy, aperistalsis. So where did you come across this? Why are you using this word? Are you a medical personnel? Because nobody has asked me this question like this. So why are you asking, Olayinka? And I cannot teach SLE. SLE is a very boring topic. I'm going to make a video on that later, but not today, not this month, not next month. Yeah, but why are you asking about SLE? I'm salivating too much and it causes bad breath and running stomach. Ladies and gentlemen, how many of us don't share this live stream? How many of us? Salivating too much, bad breath and running stomach. So, Angel Lights, if you are just coming to this platform, number one, we do not diagnose online. We don't prescribe. Number two, here is just to educate you. So, in case you are listening to me and you are trying to get what is the cause of your problem, you can't. This is not a clinic. It doesn't work that way. You understand? People are not sharing this live stream. This live stream might be very short today. People are not sharing. Ladies and gentlemen, we are making a share, beg. Make una share. So angel lights. I can't say why you are salivating. No, I don't know why you are salivating. And bad breath. So for your bad breath, what you can try to do and running. What is running stomach? Please let's now assume again. So you are salivating, you are having bad breath and running stomach. What do you understand by the word running stomach? Because I have spoken with so many patients. Somebody will tell you I have running stomach, but what the person had is different from what we know running stomach to be. So explain again. Good evening. Please, what causes internal pile? Hmm. So there are two types of pile, hemorrhoid, external and internal. Internal one is the one that is not really seen. So for you to say you have internal pile, it means you have spoken with a medical doctor. Because most times people don't know they have pile. Not to talk of the internal pile. Madam, how do you know you have internal pile? Now, pile generally means that the things around your anus, your anus has cushion, like shock absorber. Your anus has things we call anal cushions. When they become weak, hmm, when they become weak, the vessels around that area can also prolapse, can weaken, so that when you begin to go to toilet, you might start seeing blood sometimes. Thank you for sharing. Good evening. It's not sore throat. Okay. Hey, Alex. Good evening. Grace. Good evening. I go now. Morning shift. I do. Oh, I see. I share. Thank you. Mercy. Good evening. What is urethral swab diagnosis for? Hey, God. Okay, let's do this, ladies and gentlemen. Um, Urethral swab is a procedure swab for for the urethra to take sample. Is what we use to take sample around the urethra for tests. So if you have a medical complaint eh, around that region, your doctor might tell you to carry out an MCS, swab of that area to carry out a test to know what is happening. Doctor, how many eggs left in my ovaries? I don't know. I can't say how many eggs you have in your ovaries. But what we know is that when a woman is born, when you give birth to a baby girl, the total number of ovaries or eggs she has been formed inside of her. So as she grows and gets into puberty, every time she menstruates, every time she ovulates, she releases one egg. Gradually, the number of eggs begin to reduce. By the time she gets to like 35, 36, 37, the quality of the egg and the number of egg reduces drastically. How can someone balance a hormone? I made a video on hormonal imbalance. Have you watched it? Noble baby, have you watched the video I made on hormonal imbalance? What is the treatment for staphylococcus, sir? Oh God of heaven. There's a video I made on staphylococcus. Have you watched it? Ladies and gentlemen, so I make videos. I try to make health videos. I have made a video on hormonal imbalance. I have made a video on staphylococcus. The video is on YouTube. The video is on Facebook. But it will be easier for you to find the video on YouTube. So I will encourage you, go to my YouTube page, Noble Baby and Gawain. The name of my YouTube channel is Dr. Fredo Star. This one here, this name here. And just go to YouTube, type Dr. Fredo Star, click on videos. You would see the videos there. Look for the video on hormonal imbalance. Look for the video on staphylococcus. Go and watch it. Please. Number two, we don't treat online. Please, what causes someone to be fear, bad thought, and choke? So, like anxiety, like panic attack, and anxiety disorder. Well, there are many things. It could be a past experience that you might have had. It could be most times past experiences can give you that attack, and then for some unknown reason, people just have anxiety disorder. So I'm mentioning anxiety. That is the very common thing that can make somebody have this or panic attack. So you most likely would need to speak with a doctor so that they can review you totally to find out what happened. Did you lose a loved one in the past? Um, were you exposed to any form of trauma, mental, emotional, physical trauma? The nature of your job, generally your lifestyle. These are very important things that we need to find out from you. Ladies and gentlemen, people are not sharing this live stream, number one. Number two, people are not even commenting on YouTube. Good evening. Good evening. Nancy from Lagos. Why does my palm and wrist hurt or feel numb whenever I'm asleep? I usually awake feeling the pain. I can't say. I can't say because people are not sharing the live stream. Ladies and gentlemen, oh, hey God. Facebook, can Facebook update their app so that let's know people that are sharing the live? Maybe these are the people who are gonna Uncle I don't share. Thank you. Well, not too much. Thank you for sharing. So Oladuni, no, not Oladuni, Nancy. Well, in medicine, we don't make diagnosis like this. To make a diagnosis, you would have to discuss with your patient to know more about the patient. So if you are having pains in your palm and in your wrists, you feel numb. Right in my palm, okay, you feel numb whenever you are asleep and you wake feeling pain. Many things, so madam, many things. I might even tell you rubbish. I might give you a wrong diagnosis, but there are many things. It could be stress, it could be job, it could be nutritional, it could be hormonal, it could be weight gain. So for this, your wrist, your doctor will also want to examine your wrist, general examination, and also examine your wrist to know what is happening. So I can't say why you are having the pain, but generally, maybe the nature of your job, maybe weight, maybe hormonal, maybe nutrients, so many stuff. What could it be? My tongue is wide for a long time. I was given a topic to gargle, but did not go. Who gave you to gargle? I don't understand. How did you know what you have is thrush? Listen, madam. People don't come online and you give yourself diagnosis. Who told you what you have is thrush? Who gave you something to gargle? Have you seen a doctor? Your tongue cannot be white for a very long time. And so tell me, what have you done? Who have you seen? Or you are just trying to manage it on your own? Paulina on YouTube. Sorry, I meant Estelle. The autocorrect made it. Okay, I'm a medical student. Oh, you're a medical student. Correct. Thank you. Okay. Olayinka, oh yeah, ask your question again. Oh yeah, ask now. Now I understand. Which level you did? Ask your question again. You want to know about SLE? Hey, Olayinka, not on this platform. You don't want us to chase our audience away. Ladies and gentlemen, people are not sharing this live. Florence have shared. Alex has shared. Mr. Michael has shared. Augusta, good evening. Geraldine, good evening. Tracy, I don't share. Thank you. Blessing. Well done. Idowu, I see you. Idowu comments on YouTube. Idowu comments on Facebook. Idowu, thank you so much. Onome don't share. Thank you. Good evening, Victoria. Doctor, good evening. Please, is it right to have sex immediately after your menstruation? Well, madam, there is nowhere it is written that you cannot have sex after your menstruation. There is nowhere that it is written that as a woman you can't have sex after your menses. As a matter of fact, please listen carefully. Some people can even have intercourse during menses. Some people can have intercourse during menses. Now, I know that some of us listening to me will shout, God forbid, it is bad. Medically, you can have intercourse during your menses and you have no problem as long as you are clean, your partner is clean, you have no infective process going on. Okay. Um, but after your period, sure, you can have intercourse. Nobody says you can't. Most people don't want to have intercourse during their period because it is messy and they don't like the whole stuff. Let the woman clean up herself, and when she's done after the period. So after your period, madam, you meet your partner now. Okay, doctor, with your explanations about the female egg. Ladies and gentlemen, send me stars. Oh, Dr. Jason. Dr. Jason, how far? I'm coming back to you. Dr. Jason, how far? Jason, how far? How are you? Jason, how you day? Where you day? How far? How your body? It's been a while. Oh. Doctor, with your explanation about the female eggs reducing with age, does it mean that at 35 years and above, the female can't get pregnant again? No, ma. A woman can get pregnant at 35, at 36, at 37, at 38, at 39, 40. But what we just said is that the chances of the woman getting pregnant easily reduces as she increases in age. Is that okay? Nobody said a woman can't get pregnant at 35, even 40, even 45. But the chances that she will get pregnant easily, like that of a 22-year-old lady or a 25-year, is Way, way different. Is that okay? Make una share, share, share. I have shared. God bless you. God bless you. Jason Alpha, I thank you. Thanks for responding. God bless you. Now them medical students. Now them oh, now medical students, they can ask you questions, eh? Yes, I have a medical doctor in our midst. Please avoid Google diagnosis. Please, we are begging. We beg you in the name of God. And whatever you hold dear to you, please avoid it. It is very dangerous. You don't understand. How are you doing, doctor? Please, can you talk about diabetes type 2 and what kind of food they can eat? So there is a video on that, Bosse, on my page. Hmm? Just go to YouTube. Hmm? Scroll through. You will see, scroll through my videos on YouTube. You will see a discussion on diabetes. I spoke with a consultant and he broke everything down on diabetes. Hmm? Please. This is the reason why we make videos. Oh yeah, oh, if you have not shared my live stream, please, I beg, don't ask me question again, please. No vex, don't ask me. But if you have shared, though, ask me question. If you have not shared the live stream, don't ask. Just leave it there. Don't ask. Wait until you share. You cannot not be sharing the live stream and you not. Oh, mo, they don't share plenty. Oh, 39. Very good, very good. Dog, please, how can someone know a matured egg while ovulating? Hey, as long as you are ovulating, madam, your egg is intact, your egg is fine. There are various signs of ovulation. I made a video. Dr. Jason, how far? I made a video on the signs of ovulation. Hmm? I made a video on the signs of ovulation. My chief, I'm doing great though, just here. I'm learning far. You dey whine your knee. Jason, be careful. Jason, be very careful. Let me see. Jason, be very careful. Stop that. So I made a video on the signs of ovulation. Hmm? Noble baby, I made a video on the signs of ovulation. So many ladies don't even know how to calculate their ovulation. So many ladies don't know whether they are ovulating or not. There are various signs. Now, as long as you are ovulating, your egg is fine. The only thing that remains is for you to go and knock. And when you knock, meet your partner, the leg will enter. Hmm? Yes. But if you really want to know whether you have a mature egg, you will see your doctor. This is what they can do for you. Please, good evening, Taiwo. What are the 4 ways to improve men's sperm? What are the 4 ways to improve a man's sperm? Number one, tell the man not to smoke. The man should not take alcohol. The man should exercise. And the man should have a balanced diet. The man should also take fruits, should take nuts, groundnuts, walnuts, avocado. Um, these stuffs contain micronutrients. These micronutrients are very good for the sperm. Number one, if you are a man here, you want to help your sperm, don't smoke, don't take alcohol, exercise, take balanced diets, eat fruits, try to take groundnuts, cashew nuts, avocado, banana, um, watermelon. These stuffs would help your sperm. Very good. For last day, how far? Alex, Mr. Alex, what to make you the shout Jesus? Why are you shouting? Can breastfeeding and too much laundry cause stinging pain and numbness of the palm? I have shared. Thank you for sharing. Well. I can't say yes, I can't say no because sometimes during um, the postnatal period, taking care of your baby, a woman is exposed to so many stress. This thing can affect her. Now, if you are washing to laundry, it can affect your palm, it can affect your wrist. That one is there. We know when you wash with your palm, your hand, you can have pain. Very important. Yeah, yeah. Stella, nobody don't send me star this evening. Good evening, sir. Please, what causes leg pain in old age? That old age can cause leg pain that have no cause, but because of age. Eh? That age itself can cause you pain. That age, because as you get older in age, the body changes. The body does not have the kind of strength it had when you were younger. Number two, it could be arthritis. Number three, it could be Muscle issue. The muscles are becoming weak, the tendons are becoming weak. So, most especially that age itself. Amazing grandma. Hello. I have shared. Thank you. Jason Alpha. Where is Jason? I'm looking for your comments. Okay, Jason. Jason. Okay. Um, thumbs up. Okay. God bless you. God bless you. God bless. Good evening. Yes, good life now sense. I am 48 years old. I am not seeing a man since 3 years. I wanted to stay like that. Is there any problem? Madam, as long as you have decided not to meet any man to stay like that, there is no problem. As long as it is your decision, mm, you have no problem. As long as it is your own choice. So, we live by the choices we make and the consequences attached to the choices we have made. So, for every decision you take in your life, it has a consequence, whether good or bad. But if this is what you want to do with your life, you don't want to meet any man, so be it. Live your life, enjoy your life. Case close. Tosin, 400 level, doctor. Hey, just a brief pathophysiology of SLE and also why a peristalsis under abdominal ultrasound scan as a post complication. Because I believe the uterus as the surgical area doesn't extend. Please share more like my guy. Oh, Tosin, you cannot be doing this on this platform. You want to chase the audience. So let me help you, my brother. I'm not, I see. You see this platform here right now? We have people who are not medical personnel. The moment you start bringing in this big, big medical grammar, you chase your audience away. It's very important. So if for any reason we want to discuss something like this, it has to be very private. It has to be like a medical session where you have medical doctors and medical students. We begin to move stuff. Let me tell you something. See this word you mentioned, aperistalsis. Aperistalsis is a complication of surgery. Hmm? Most times abdominal surgeries. Let me just talk quickly, briefly. Aperistalsis, you had surgical procedure, you tampered with the intestine, the bowel. Sometimes it might not move immediately. Might take a while, either because of electrolyte imbalance or because of the handling of those bowels. You understand? Yeah, there's a lot. It's very deep. So this is why it's advised that you prepare your patient adequately before surgery. Mm. It can happen, but though not common, but it can happen. Now for SLE is a very deep area. I can't go into SLE today. I swear to God, SLE is very, very deep. Yeah, no vex, my brother. You're doing very well. 400 level, you're almost there. Don't worry, you understand. Hmm? No vex. Hmm? What are the causes of low sex drive? Your age, stress, hormonal imbalance, emotional strife. You can have a low sex drive. So as you increase in age, sometimes your sex drive goes down. When you have hormonal changes, hormonal imbalance, your sex drive goes down. Stress can bring down your sex drive. When you are very tired and your partner is touching you, you tell your partner, "Don't touch me." You say now sex in my mind. I want to sleep. You are touching me. You understand? And then once again, maybe nutritional issues too. Hmm? Let's see. Oh, has anybody sent me star today? Nobody has sent me star. Okay, Olayinka. Yes, I see your comments. Uh let's see. I don't know how to send stars. So if you're on the live stream with me, whether you are on any of my page, they don't come on this one. These people, they know they use this thing play. So if you want to send stars, on YouTube people should send me super chats now. So let's see how to send stars. Let's see if it's here. If you want to send stars, you have to go to Dr. Fedosta official. Go to Dr. Fedosta official and click on this star. See this star beside the like here. What, doctor, please, as someone that which kind of food the person will be eating? Eat your normal food, madam. Madam, eat your normal food. Number two, if your fibroid is very, 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 very big and disturbing you, your gynecologist will tell you what to do. But if you have fibroid, nobody says you can't eat and you should avoid certain food. Eat your normal food. Eat your normal food, please. I know that there are some write up that says if you have fibroid, avoid this kind of food. If you like, avoid that food. If the fibroid will grow, it will grow. If the fibroid will get enlarged, it will. You understand? What feeds the fibroid is actually hormones. You understand? Hormonal changes in your body. Fibroid uses hormone to grow, enlarge. It's not because of the food. You can go to my page on YouTube. You'll see video. Watching from Canada. Doctor, I'm salivating too much and it causes bad breath and stomach pain. First of all, you said it causes you bad breath, you're salivating, and you're having running stomach. Now you have changed to stomach pain. Since when? What have you done? Remember, this is not a clinic. Eh? Please. So I can't prescribe anything for you. What have you done concerning this? For how long? If someone is breastfeeding and got pregnant, can she stop breastfeeding the baby? Ah, if you are breastfeeding and you get pregnant, somehow that pregnancy might might gradually stop breast milk from being produced. And then if you get pregnant and you are breastfeeding your baby, it's important you go see your doctor quickly so that they help you, so that you can still take care of this baby and also take care of the new baby that is coming. Mm. Uh, Now, so good life now sense. Thank you. Can cream cause sclerosis on the foot? What do you understand by sclerosis? No, they tell me sclerosis. What do you know is sclerosis, Madam Jane Chiwe? What they tell me? Are you a god? What is sclerosis? What is sclerosis? Please help me. Let me know that we are together on the same page. Madam, don't come online and be telling me can cream cause acanthosis nigricans. Hey God. Good evening. What causes this thick white discharge? Even on my period, I still see some of it. Well, white discharge. Um, most times when a woman has discharge, Bella, most times the white is discharge. Most times it might be due to fungal. Most times in quotes, but sometimes it can also be due to irritation around that region. So you have to be sure what is causing your whitish discharge because you can have other symptoms like itching, you can have other symptoms like redness around that area. Mm, yeah. So you have to be sure exactly what is causing it. It's not normal, especially if the discharge is now much. A woman should have whitish discharge during her ovulation, and sometimes um, when she's like on heat, in the mood. But this discharge is not that much. It's not thick like foam. Let's see. Oh God. Okay. In case I'm not reading your question, it means I'm missing your question. Good evening. Please, why do menstruation stop? I'm 28 and I've done a lot of tests and I'm told I'm okay. I had my period on June last year and after some months I saw it with the help of my dog and now it stopped again. What can I do? So you're 28, your period has stopped. So your doctor said you're fine with the help. Okay, last year and after some months I saw it with the help of my dog and now it stopped again. So Mrs. Omoni Wealth, ah, this one, I can't say. You know why? Because you have seen a doctor. I don't know what they checked. Did they check your hormones? What is your job? What's the nature of your job? There are some things you can do that can make your period stop. Oh, you can lose weight. Weight loss can make your period stop. Severe forms of stress can also affect your period, can make your period stop. Hormonal changes. So I don't really know what the test you have done. If you have not seen a gynecologist, I think it would be best to see a gynecologist so that they check you very well. I don't know if your doctor is a gynae or not, but I think the best person you should see right now would be a gynecologist because there are many things that can actually stop your period. You are very young, so your period should not stop. If it does stop, the doctor will have to examine you and check you. So maybe you should get a second opinion from an expert. That is, if you haven't seen one. Can a man with one testis make a lady pregnant? And what are the causes and effects? Yes, a man with one testis can make a woman, can impregnate so many women. A man with one testis can impregnate so many women. What can make a man have one testis? Maybe the other testis did not develop. Maybe he had undescended testis. When a woman is pregnant with a boy child, the testis is inside the stomach, the abdomen. As the pikin dey form, towards the time that the baby will come out, the testis go move, enter the scrotum. Sometimes the testis, one go enter, the other one will come down. Hmm? It's called undescended testis. There's a medical name for that. It can happen in some cases. Some other men can have a problem, they can have injury, uh, they can have a trauma that can affect one testis. But if a man has one testis and the testis is okay, he can surely impregnate so many women, not just one woman. Good evening, good life na sense. Thank you. Make una share. I asked you a question. Doctor, please, how can someone eat healthy? Yes, my dear, you can eat healthy by thinking, first of all, how much money do I have? What is my income like? What are the kind of food available? So we have rice, we have beans, we have yam, we have we have we have plantain, we have gari, we have potato. Um, what other food again do we have? We have egg. So what you can do, you can plan it. You understand? Junk food like your burger, cheese, hot dog, shawarma, and the rest, they are not healthy for you. Mm. So the food I mentioned are healthy. Vegetables, these are things you can ration, plan. Rice. Sometimes, if you don't have money, you can boil white rice with vegetable. It helps you. Yep. So at this program, it will go a long way and help a lot. Thank you so much. But people are not supporting me by sharing my live stream. Yeah, Ivy, I have answered you, no vex. Doctor, can sperm from low count be used for IVF? Yes, sure, it can. Okay, Chinwe, sclerosis, hardening of the skin. So, uh, cream might cream might not cause hardening. So I want to be sure you know what you're talking about. But sclerosis is a little bit more than that. Cream might not cause sclerosis per se. It might cause hyperpigmentation. Maybe the hyperpigmentation might now lead to the sclerosis, or it might cause change in color. It might cause burning sensation. It might cause scaling of the skin. The skin begins to peel. Cream can cause that. uh, can cause dermatitis, itching, rash. Yes, can cause that. So, if it will cause you hardening of the skin, it might not be immediate. It might take a while. I hope I've been able to answer you. Yeah. I researched on the symptoms of sclerosis, which include hardening, darkening of the skin layer, which is most times painful. You see, so hard sclerosis is the end of the spectrum, not immediate. And we have different types of sclerosis. Hope you know. Any medical explanation as to why someone will be sweating on the palm and feet? Yeah, yes. When you have sympathetic overdrive, since you asked for a medical explanation, sympathetic overdrive. So what I mean by sympathetic overdrive simply means that you have your nervous system. We have the nervous system that you can control. We have the one you cannot control. So the one that you cannot control is called autonomic nervous system. That autonomic nervous system has two parts: parasympathetic and sympathetic. I'm sorry, I'm going deep into medicine. I'm sorry. Now, sympathetic, your heart, when you hear gunshots, when you hear a gunshot, your heart begins to beat fast. True or false? When you are a guy, you are toasting a lady, for the guy is here. If you don't scope woman before, Maybe you see babe where you like. When you go near the babe where you like, when you were very, very much younger, your heart will be a bit fast. You can't control it. Um, which one again? It's so big, so big. So let me use this example now. You can't control that one, it moves on its own. Also, it can happen to your palm and your feet. Your sympathetic nervous system can begin to function very well, so much that you begin to sweat in your hand. That is one of them. Number two, hormonal. Hormonal issues too can cause that. Good evening, oh Benjamin. Happy Sunday. Something infection stop period mostly. Who told you that infection stop period mostly? Who told you that? Infection can stop period, but not common. Infection will not stop a woman's period for 1 year. Madam, this whole rubbish people say in the market, madam, if your period disappear and infection can stop period, but not common for everybody. Hmm? Not for everybody, because any small thing, you don't get infection. There are so many women that have infection, but they are still seeing their period. However, there are some other group of ladies who have infection, so-called infection, and can't see their period. It's left for your doctor to be able to arrive at that diagnosis. But I don't believe that a woman will have infection for more than 1 year. And no, now that infection will spoil the woman life. Hope you know. Hmm? Yes, he's a gynecologist. Okay, so please, on wealth, I think the best advice I have for you is please speak with your doctor again. Ask your doctor what is the solution. This period is not coming. What do you think I should do? Should I see another gynecologist? What do you think? If your doctor tells you to relax your mind, so let me tell you something. Hey God, I don't dey tire. Oh. I don't dey tire. Oh. I don't dey tire. Where is not only me did this live stream tonight? Ah, I'm getting tired. When you're talking medical, you're cracking your brain. I'm getting tired, guys. Ah, I saw a patient some time ago. This patient did not see her period for 1 day, but she born 9 children. She's late though. Now I wish I was into social media then. I swear to God, I for record her. The day she told me, I did not believe her. I was like, Mama, you dey lie to me, you dey use me play. She said, no, my pikin, I no see period, but I born nine. Nine. She was a grandmother then, oh. Her children don't go, don't born. That's the first time. That's the very first time in my life I saw a lady who did not see her period. And then since I came to social media, I've also seen two other ladies that told me they didn't see their period and they got pregnant. You understand? They had given birth. So it's left for you to speak with your doctor, make he check you more. He's a specialist, he's an expert. I think he has more knowledge than me. He will help you. But if you are not cool with your doctor, you can still see another doctor. Lucy, how far? I don't dey tire. Oh. I don't dey tire. Oh. I don't dey tire, guys. I think we'll end this live stream very soon. What could be the cause of severe waist pain and hotness of the belly or the belly or the abdomen? So severe waist pain. Severe waist pain could be due to your spine. If the pain is very severe, it might be due to the bone around your back. Your back. There's bone there. If that bone get issues, it fit cause you waist pain. So if you are having severe waist pain, the best thing to do, make dem investigate you. No go lab or go and see a medical doctor first. Make dem find out wetin dey really cause am. And then some people can have weight gain. Weight gain can cause them waist pain. The kind of job you do can cause them waist pain. People can have malignancy. Some people can have cancer. Cancer can move, can affect the bone of the waist and cause them waist pain. So there are many things that can cause you waist pain. This is why you should speak with your doctor, because your doctor is trained to examine you totally to find out if this waist pain is from something else or from just the weight itself. I don't dey tire. Nobody don't even send me this. I don't tire. How are you? I'm not fine. I don't tire. Maria, how far now? Maria, I don't tire. These questions just they crack your brain. I mean, you're cracking your brain. Um, People just think it's the same thing like your comedians or your skit makers. Eh? We are not the same with them, I beg. So my brain, I don't tire, guys. No, no vex. I don't know why I'm getting tired. What causes upper? So for your waist pain, so I've told you then hotness of the abdomen. My brother, I don't know. There are many things that can cause you hotness of the abdomen. So many things, so many things. If your belly, if your stomach they hurt you, we have to know when. We have to know where they hurt you. You have to know when it starts. Maybe gastritis, maybe peptic ulcer disease, maybe gastroesophageal reflux disease, maybe pancreatitis, mm, it could be cholelithiasis. So many things, my guy, because you hotness of the belly. So I don't know what they cause your own. Like I always tell people, this platform not to just educate you, no be to treat anybody. I no come here to treat, I no come here to prescribe for anybody. I don't come here to take the position of your doctor. I just come here to educate you. Now, Dr. Israel, they come. When I don't tire, guy, now you they come, Abi.
Sorry, I just closed from church. I'm just coming back from church.
Before tell me now, uh, I don't know now.
Good evening.
If you just think I get hope, say you they come. How far? How you dey? So we have Dr. Israel in the house. Uh, okay, Doc. Good evening. Is
You said
pounded yam or yam very healthy? Dr. Israel, I beg respond to this comment. I don't tire. I beg.
I'm fine. Oh, I just got
Is pounded yam or yam healthy? It's healthy now. Yam is our food. It's our natural food now. You eat pounded yam if you can.
but the yam or yam. They are very healthy and they are carbohydrates and they are good food you can eat. Except maybe you have even when you have diabetics, you can still eat it, but you not take it in little quantity. You can still eat it. So far you are taking your medication very well. You still can eat it, but take it in a little quantity with a lot of vegetables. So a lot of vegetables. Yeah, they are very healthy.
Okay. Doctor, what can someone use to treat treat imbalance hormone? Not here. Your doctor. Go and see your doctor. Yeah. Not here, please. Not here. Thank you. No vex. Is it possible for someone who has done an ovarian cyst operation to develop it again after a few years? It's possible. Yeah, it's possible. It's possible. It's possible, and it's very possible. This is why you should be speaking with your doctor. It's possible, oh, eh? It's possible. I salute you. Thank you. Sir, can someone get pregnant in a normal way and give birth up to 6 kids? How? You are pregnant and you give birth to 6 children at this once. 6 children once, or first time, second time, third time. Yes, now you can. But the current WHO guideline says that a woman should not give birth like you dey born football team. Give birth to the kids you can take care of, number one, and give birth to kids so that you too you'll be fine. You understand? Yeah, but you can. Doctor, thanks so much. Remain blessed and alive. I'm living. Okay, thank you. I'm learning a lot. God bless you. God bless you. Is it healthy to drink coffee every day? No, it's not healthy. It's bad. Coffee every day will give you problems in the future. Coffee contains caffeine. You might get addicted to caffeine. Caffeine can cause you palpitations. Caffeine can cause you anxiety disorder. Caffeine can also affect your sleep. Caffeine can affect your blood pressure. So I would not advise you to take coffee every day. No, no. However, there are some medical conditions where your doctor can actually prescribe caffeine for you to take. But if every day of your life you are taking coffee, you are playing with fire. Doctor, what causes ball under woman? I don't understand your questions. I don't understand. Greetings. What will make 9 years old girl breathe fast up and down whenever she has cough? The cough is causing a problem. Is the cough, my dear? Now the cough, eh? Let us see a doctor. Now the cough. Yeah, Dr. Israel, please respond to this. Maybe I didn't respond very well.
For a 9 years old baby, a child having fast breathing up and down and ask cough, please, you have to see a doctor. You have to go to the hospital. It's not it's not something you just sit at home doing nothing. It's maybe they want to look for other things that is wrong with the child. If there is fever and all that, so that they will actually look for, so that she can be treated. When you need to go to the hospital, it's not what you go to pharmacy or chemist to go and tell them to give you to go and tell them what you just said now, for them to give you some drug. It's not going to work that way. Please, for the child, for the sake of that child, please go to the hospital. It will really, really help you. It will really, really help you. Thank you.
Okay. What causes constipation? I made a video on constipation, Charity. Hey God, there's a video on my page on constipation. So constipation can be due to your lifestyle, your food. eh? Food can cause, when you're not eating fiber, fruits, you can develop constipation. When you're not taking water, you can develop constipation. When you have a problem with your bowel, when you have a mass in your bowel, you can have constipation. And there are so many types of constipation, you understand? And when you have something also compressing your stomach, your intestines, you can have constipation. Most times, people that have constipation is due to water. They are not taking enough water. There's acute and chronic constipation. So if you're always having constipation recurrent, you should speak with a doctor. But if your constipation, that is, you're not going to toilet, it just started, take water, take fruits, vegetables, and see if it will relieve you. Okay, Israel. Israel is not here. Okay. What is the reason for pain from
Yeah,
the
you
nail
said
to
it. You
under the?
said it.
Okay. What is the reason for pain from the knee to the on to under the feet? Dr. Israel, do you have any comments to this? I can't say. Oh, I don't know. I don't know. I can't say. I can't say. Trust me. I can't say. Ladies and gentlemen, if you are just coming, you are welcome. Please share the live stream.
Okay,
Don't
from the
forget you
knee
can
to
send
under the feet.
stars.
The next question is, what kind of pain? Is it like a shocking pain? I want to know the kind of pain. If it's like a shocking pain, like you're feeling shock.
Okay. The type of pain, thank God, Dr. Israel has said, the type of pain will help us. No, the type of pain. There are different types of pain. You understand? Different types of pain. Good evening. Sorry, thank you. Doctor, how to know I am addicted to and effects? How to know if you are addicted to porn? How to know means that you can't do anything without watching it. If you don't watch it, you don't feel okay. Every day of your life, you want to watch it. If you don't watch it, something is wrong with you. You're always attracted to it. What are the effects? What are the effects? What are the effects? I don't really know. What are the effects? I don't really know what the effects. I will have to read about it. What are the effects of the addiction? I hear that it can affect your relationship, can affect your life, your family, your relationship with your partner. I have a friend who said she sees her period once a year and she has given birth. Congratulations to her. Thank God. How are you? Yeah, Maria, I'm doing very well. Please, you are sick with malaria and typhoid, and you have blisters on your lips. What is the cause? Nobody say you have malaria and typhoid. Who told you you have malaria and typhoid? Oh, Dr. Israel, please respond, I beg. I don't tire. Dr. Israel.
Okay. Actually, that's the first question. You want to know if you really are you hearing me?
Yes. they hear you. I can hear
Can you
you.
hear me?
Dr. Israel, I they hear you. I they hear you. Um, I can hear you. Where you now?
You want to know if you really if you really have.
Oh God. You see your
You want to
network. This
first
your
of all know
network,
if you
eh?
really have malaria and typhoid, because most of the time having blisters in your lips and in your mouth may not be due to malaria and typhoid. They can be due to reduction in your immune system or some viral infection can actually cause.
Okay. So what you have is not malaria and typhoid. So if you want to know whether you have malaria and typhoid, you have to see a doctor to really help you make the diagnosis. Blisters in the mouth is not malaria and typhoid. That might just be herpes. Um, Ladies and gentlemen, we have 4 minutes more. I have to go. Eh? We did enjoy your session. Though. We left the stage for the women while listening. Okay. Oh. The guy is not the ask. Oh. Mr. Alex. Mr. Alex. The guy is not the ask questions. They want the private chat me. They want the enter inbox, they ask questions. They need they ask. Eh? And they know say I know they do private chats. I beg. Guys, ladies and gentlemen, we are rounding up. Good evening. Please, what makes someone dizzy after eating? And at the food. When you eat, blood go gather for your stomach to break down the food. You feel sleepy. It's a normal process. After eating, you feel dizzy because more blood will have to go to your GIT so that your body can break down the food quickly and spread it out. So when the blood goes to your stomach, you might feel dizzy from the brain. Uh, is it possible to replace amniotic fluid that is 80% lost while drinking oral and liver water? No, you can't. No. Hmm? You can't replace amniotic fluid through drinking water. It can't work, madam. Mm-mm. Doesn't work that way. Please, doc, can any physical condition cause fear? Yes, now. Like armed robbery attack, like accidents, eh? Post-traumatic stress disorder, PTSD, can cause fear. Previous events in your life can also cause fear. What causes blister on the lip during malaria and typhoid? That is not malaria and typhoid. Blisters on the lip is not malaria, is not typhoid. Blisters on the lip is due to um, herpes labialis. Eh? That's not malaria, please. Blister on the mouth is not due to malaria. That's not malaria. That's herpes. What causes headache all the time? Please go and see a doctor. I beg you. If you're always having headache, you should see a doctor. Huh? Good evening. I'm addicted to coffee every day for the last 13 years and trying to limit how many cups daily. Mr. Alex, oh yeah, reduce your coffee intake. The earlier the better. Please, I beg you. Please, the earlier the better. Coffee causes addiction because of the caffeine. Caffeine is a stimulant. Caffeine is a stimulant. That stimulant can affect your life very well, can increase your blood pressure, can affect your sleep. Uh, oh my God. Ladies and gentlemen, I have tired. I have tired. I have tired. I have to go. Eh? Okay, my guy don't come back. Oh yeah, come and answer them. Guys, ask questions. Guys, guy, it's almost time to rest, to end. Oh, I can't hear you. It's time to end. It's time to end. Oh yeah, Alpha, let's answer
Yeah,
two
I know.
questions. Okay. Okay. See the
If
question
network
here.
will allow.
Hello. Can you see the question? See the comment. See the comment.
Yeah, I'm seeing it. There's not a shocking pain. There is like there's fire. So much someone set fire on the leg. Okay, if you're having those kind of pain and look as if it's a burning sensation, like a burning sensation in your leg. Um, I think you want to also check your sugar level, and you want to check your sugar level, and you also need to see um this. I don't think this have anything to do with your bone for the meantime. Yeah, yeah. So we also want to know how old are you. If depend your age will also help us to know what we can say. If you are almost getting to 40 something, or if the person you are talking about is almost getting to 40 something, it will be something we don't need to be troubling ourselves about. We know that it's going to be like that. Hello,
Okay.
you they hear me?
Yes, 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 yes.
You they hear me?
Yes.
Okay, so
Oh my
you
God.
if the age is almost 40 something, if the age is almost 40 something, we'll be thinking of getting to menopause and all that. So you not be afraid, you not be thinking of that. Then we'll not be calling it hot flushes and all that. So these are just a few things I want to say. So first of all, you know your age, also check your sugar level, and if what I said is if what I
Okay.
said is if the age is not within what I said, you also need to see your doctor. Just see your doctor.
Yes, ladies and gentlemen, we have to end the live stream at this point in time. We have tried. I'm sorry, we can't continue. We can't take more questions. You should do well to join us next week, Sunday, or during the week when I'm online and you see me online, you can ask me your questions. But right now, it's time to go. I want to appreciate every one of you for taking your time to join us. Thank you very much. I'm sorry if I couldn't respond to your comments or your questions. Next time we'll come online, we'll surely do that. Please, no vex. Like I always say, good life, good life, nah sense. Thank you and have a lovely night. Take care and bye bye.